It stretches as far as the eye can see. Home to almost 35,000 people, Mela is one of the largest refugee camps in Thailand. Some born here have never known anywhere else. Others have fled from war-torn Myanmar, just a few kilometers away. Until recently, healthcare inside the camp was supported by USAID, but with funding suddenly cut, the camp's residents have been plunged into uncertainty. And for Ma Tanda's husband, the consequences were fatal.
He was going up and down the roof and he slipped and fell. They told me that since there was no more aid to help patients, the family would have to pay for his treatment. The hospital asked for 300,000 baht, so I explained to them, since we come from the refugee camp, we didn't have 300,000.
With urgent surgery needed, the family tried to gather the money, but before they could pay, it was too late.
We don't want anyone else to suffer like our family has.
The US used to support 3 health clinics inside this camp. While other NGOs have tried to fill the gap left by Washington, the closed doors and locked gates that once led to this clinic show the camp's healthcare is still running at limited capacity. And since USAID cut its funding, it's areas like this refugee camp that have experienced the fallout. People here are now unable to access quick healthcare that they were once able to get, and they've been forced to find alternative solutions. Some 20 kilometers away, this director explains his clinic is trying to help, but they don't have the equipment or staff to treat serious injuries.
Some cases we have to refer if they are uninsured patients. So when we refer the complicated case, most hospitals cannot accept them because who will pay for the medical treatment.
Despite this, the clinic is doing what it can and has opened its doors to Mela's residents, like Mimi. For her, the joy of becoming a grandmother has been replaced quickly by financial worries.
The baby had to be delivered by cesarean section. I have financial difficulties to pay for the medical expenses, and I don't know how to do it. I am asking for help with the hospital expenses because I am struggling to live and work.
But the hospital can only do so much, and the influx of new patients now risks pushing the clinic into its own financial difficulties. Despite this, the director says as long as they're treated here, Mela's residents can pay whatever they can afford. To him, in the face of cuts to USAID, the health of his patients is more important than money. Camenzind Broomby, TRT World, on the border between Thailand and Myanmar.